Hello and welcome to our presentation entitled Healthcare System Navigation and Migrants in Ontario, Canada, Learnings from our Knowledge Translation Workshop. Canada has welcomed close to 300,000 Ukrainian migrants, as well as approved close to 1 million applications for asylum between March 2022 and April 2024 as a result of the Russian invasion of Ukraine. This population experiences extensive acute, chronic, and complex health issues as well as mental health challenges because of such an invasion. However, we know little about Ukrainian temporary migrants' knowledge of the Ontario healthcare system and their immediate medical needs, as well as healthcare system navigation. So the purpose of our work was to explore the lived experiences of Ukrainian temporary migrants navigating the Ontario healthcare system and to report on the results of a knowledge translation workshop intervention that we developed and delivered with this population to assist in the development of knowledge and skills related to healthcare system navigation for Ukrainian migrants. On this slide, we list the theoretical frameworks we use to inform our knowledge translation workshop. As you can see, knowledge translation is that cornerstone theory, as well as the social environment theory, person-centered care, and population health models. And on this slide, you can read further about each one of them. In terms of the method, we did execute a 2-hour workshop comprised of 3 sessions, and we comprised those 3 sessions of a presentation and a discussion format. The first session focused on the differences between the Ukrainian and Ontario healthcare systems, the second on the roles participants want to play within their own healthcare and can enact in interprofessional teams, and the third one being active and productive collaboration with healthcare professionals for their well-being. We then executed inductive and deductive thematic analysis on the data that we collected as a result of these workshops sessions. In terms of the results, our study did produce 4 key themes, and in subsequent slides, I will walk you through each one of the themes. On this slide, you can also see a picture of one of the sessions of the workshop. In terms of the first theme, concerns regarding accessibility and wait times, learning more about the Canadian healthcare system was helpful for Ukrainian migrants, but the information was not useful if they could not actually access those services in a timely way. The wait times were extensive in terms of access of healthcare, but particularly they were surprised and shocked about the wait times for mental health service accessibility and utilization. They expressed the belief that in the Ukrainian culture, mental health does not exist. So in Canada, they were seeking out such services and supports. As an example, one of the participants quoted, "My husband was angry. He wondered, is this a hospital or what?" after having to sit in a waiting room for over 5 hours with a child with a broken arm before they could even see a doctor. The second theme talks about difficulties with navigating the Ontario healthcare system. They cited several barriers that they are presented with, such as lack of knowledge of the healthcare system, language barriers, Canada not having an online system for accessing health services like Ukraine does, extensive out-of-pocket expenses, especially for services not covered by a provincial healthcare plan. And you can see 2 quotes from participants listed for you on the slide about their experiences specifically. The third theme talked about transnational health practices, how some migrants actually chose to travel back to the war to receive certain services because they could not access them in Canada within a timely way, and because of the language barriers present. Again, 2 quotes are presented for you that you could read about participants' experiences. And the final theme is desire for increased involvement in the plan of care. They wanted to be involved in their plan of care. They wanted to have better connections and relationships with their healthcare providers, but because of lack of cultural competency training in some of the healthcare providers and language barriers, it became problematic. Participants also talked about the issue of having that one problem per visit when they presented with mental, social, and health challenges. And again, you can see an example quote on the slide for you from one of our participants. Overall, our study highlighted the difficulties Ukrainian migrants have in accessing our Ontario healthcare system due to language barriers, lack of knowledge, prolonged wait times, and services that are not covered by a provincial healthcare plan. We need to look at other asylum-seeking groups and study them to determine whether they have similar or different experiences to learn how we can improve our healthcare system. And we need to deliver culturally competent care, ensure we have enough time to foster therapeutic relationships to really promote trust in the healthcare system. On this slide, you can find my contact information and a link to our references. Thank you so much for listening.